Okay, so there's still more people coming in, but we'll start slowly. My name is Natalie. I'm one of the members of YAHPA. Welcome to our virtual event tonight of healthcare professionals at a glance. Today's event is going to end around 8 p.m. and we'll have a total of 8 presentations. And you guys already have the schedule for who's going to be there tonight. We have like 3 simple rules for the event. So the first thing is each professional is going to have 20 minutes, 10 minutes of presenting, and then 10 minutes of questions. So if you have any questions, just ask them in the chat, and I'll ask them all out for you. Or you can also open your video and like ask yourself to the presenter. We also have a 5-minute break in the middle of the conference. And then again, you're welcome to open your cameras. It's just more fun for everyone, but we're not going to force anyone to do it. The second rule of our event is, our goal is to try to make students discover a lot of the variety of professions in healthcare that exist here. So our goal is not to do a 101 on how to apply. It's not about the application process of any specific program or school. So if you have any questions on that, I invite you to visit the official admission pages of different schools. And then the third thing I want to address before we start is that we have a survey at the end of the conference, and it'd be very useful for us if you can give us some feedback and for our next events. So I want to give a big thank you to our whole team and all the speakers who accepted to present tonight. And they're mostly doing this on a volunteer basis. So thank you everyone for your time and for making this event possible. So I'm going to welcome our first speaker, who's Dr. Zheng Xu, who's a clinical psychologist.
Hi, everyone. I'm Jen. Thank you, and thank you for the invitation. So happy to be here today and like to share with you my journey of becoming a clinical psychologist, and hopefully it'll be helpful to all of you who are in the process of selecting your career path. Okay, so we can get started. All right, so just starting out with talking about what we do, like what is a psychologist? So basically we help people who are experiencing psychological distress or difficulties, and we're experts on behavior, emotions, and mental health. So every psychologist has studied psychology at a university for at least 7 to 9 years. So that accounts for about 4 years on average undergraduate studies. Quebec is a little bit different, I guess, if you went to CEGEP. 1 to 2 years for a master's degree and 5 to 7 years for a PhD. And to become a psychologist in Canada, you must obtain a PhD. So our training enables us to understand human behavior and find the best ways of helping people resolve psychological issues. Okay. So psychologists engage in research, practice, and teaching across a wide variety of topics having to do with how people think, feel, and behave. So in general, the majority of psychologists actually work in 5 broad categories, as written on the slide here. So research, teaching, service provision, positions, administration, and consulting. And many combine 2 or more of these categories. So for example, a university professor usually teaches and conducts research, and they may also be an administrator and a psychologist providing help to their clients in private practice. So our work can involve individuals, groups, families, as well as larger organizations and government in the industry. So now, most of the time we think that psychologists work with people, right? They can also work with animals if you'd like. Okay, so now if a psychologist chooses to work with human beings, this is what I'm doing, I work with humans. So we assess the person's psychological functioning and mental health. We identify treatments or interventions that might help these people and carry out the treatments or interventions that we're qualified to provide, such as psychotherapy. And if we believe that the person needs medication, then we would recommend them to see a doctor. So psychologists, we carry out many different interventions, and the most frequently requested are psychological diagnosis and psychotherapy. So by talking with the patients and doing interviews, and we carry out any relevant tests as well, we would evaluate a patient's resources, strengths, limits, and challenges. So all of which have an impact on their thoughts, on their mood, as well as their behavior. So psychological diagnosis, this aims to identify their issues and also establish a plan for intervention and treatment. And so during psychotherapy sessions, the client and the psychologist would together explore the client's thoughts, emotions, behaviors, or habits that led them to seek help in the first place. So psychotherapy, it's a very effective treatment that may take on different forms depending on the psychologist's approach and techniques. And so this is exactly from the Order of Psychologists of Quebec website of what psychologists do. And I'm going to post this in my resources page later on. You can check out on your own the exact definition here. Okay, so I'm not going to go through it due to time constraints here. So we can go to the next slide. So to use the title of psychologist and to engage in professional activities as a psychologist in Quebec, one must have a PhD in psychology, as I said earlier. I think this applies in the rest of Canada as well. And you must be a member of the Order of Psychologists of Quebec, the OPQ, and also comply with all existing laws and regulations, including the Code of Ethics. So this is my personal clientele. The people that I work with are children, adults, and children, adolescents, and adults. And to the right side of this slide here, it's the specialties that I work with. And so through graduate school and your PhD, you do have the choices, different streams that you can choose and different practicum activities, directions that you can choose from. And these are the ones that I chose from mood disorders like depression, anxiety, stress, and anger management, eating disorders, OCD, ADHD, etc. But of course, you're not limited to this. If you have other interests, there are endless possibilities. Okay, as you'll see in the next slide here. This is only a fraction of what are the possibilities. And you can check this out, the entire list on the Canadian Psychological Association website, which I'll post later. So, if you're interested in working with people with brain injury, pain management, cognitive functioning, intellectual ability testing, criminal psychology, addiction, sports performance, etc. There are just so many possibilities that you can choose from. Okay, and this is just a small fraction of it. Okay, so up until this point, I've talked about the training as well as what psychologists do. You're probably wondering about, well, what are the job aspects, right? We are in high demand, right? And well before the pandemic, right? Right now, mental health is talked about more, which is a good thing. But even before the pandemic, we have been in high demand. And the unemployment rate for psychologists has historically been very low. And so over the period of 2019 to 2028, new job openings are expected to total more than 15,000. And this is stats from the Government of Canada website. So the projected job openings are expected to be substantially higher to job seekers. And employment growth, this is expected to be much stronger than the average of all occupations. And this is fueled by the population's greater awareness of social issues such as population aging, mental health, learning issues, disabilities, and violence. And so where do we work? Some psychologists work primarily as researchers and faculty, so university professors at universities and at government or non-government organizations, while others primarily work as practitioners, clinicians in hospitals, in schools, clinics, correctional facilities, employee assistance programs, and private offices. And many psychologists are active in both research and practice. So life as a clinical psychologist, it really depends on where you work, how many roles and responsibilities you have that you choose to take on. So for example, the ones who work in both research and private practice, then they might have to balance that a little bit more, right? Maybe more responsibilities that they choose to take on. In private practice, there's definitely a lot more flexibility that you can choose the number of caseloads and what populations you choose to work with. Right? So same thing with stress level, that will depend on where you work, your caseload. And so depends on whether you work in public or private system as well. In the public system, you might be assigned caseloads, but in the private sector, you might have more choice and flexibility as to how many and who you work with. Okay. Now, why did I become a psychologist? So personally, I've always been fascinated with human psyche, with why people do the things that they do, human behavior. And I think the profession, the more that you study, it helps people understand themselves, certainly helped me understand myself better, understanding people in my life. And I've always been a people person. So working, let's say, with machines or with things that are not related to human interactions, I wasn't as interested in. So you have to be sort of a people person if you want to work as a psychologist, I think, unless you work with animals, as I said earlier on. But if you work with humans, you meet a lot of people on a regular basis. And research was also very interesting to me to do a PhD, and it's quite lengthy, right? This whole journey. So you have to research to some extent, as well as working with other professionals. So, and it can be very interdisciplinary. So you can work with, social workers, nutritionists, and if you take on cases that involve the law, you might even be working with lawyers and police. So again, it depends widely on what populations you work with. Okay, and the best versus worst aspects of this job. So I'll start with the worst. Definitely, it's witnessing a lot of suffering of people on a daily basis, some of which can be very heartbreaking and traumatic experiences that people have gone through in their lives. And it can be draining if you don't balance helping others with your own self-care. So especially I think throughout this pandemic, mental health has been a really big issue for a lot of people. So for those who are working the front lines of mental health professionals, we're facing this on a daily basis, people's burnout and all the difficulties that they face every day. So it's very easy to burn out ourselves, I think, without self-care. And we're also at risk of mental health issues ourselves. And compassion fatigue, I think it's a common problem for a lot of therapists. Now, the best sides of this is that it's extremely satisfying to witness people's growth, especially if you're there from the beginning, right, when they were first seeking help, and then you grow with them, I find. So it's extremely satisfying to see people's recovering mental health, their state of being, and overall their relationships with people improve. So it's so satisfying to see that. And also meeting people all the time, basically. We do a lot of new evaluations, depending again on your caseload. And well, I guess it depends on how you see it, right? Like if you like meeting new people on a regular basis, then this is one of the best aspects. If you don't like people, it can't be seen as one of the worst aspects. Yeah, but I see it as one of the best aspects of this job. And so the last thing I'm going to talk about before we wrap is the differences between these 4 different professions on here. So psychologists, we are trained based on the scientist practitioner model in our graduate study, so PhD. And so we're scientifically trained in both research, how to conduct research, as well as clinical practice. So psychiatrists are different though, because these are medical doctors. So they go through medical school with medical training and end up with an MD degree. And they specialize in mental health. And I think psychiatrists, a lot of them do medication maintenance. So they do have the right to prescribe. And so now the next one, psychotherapist. So this is a professional who has obtained a psychotherapist permit. So it can be, you know, another healthcare professional such as nurse, social worker, or marriage or family therapist who are interested in doing psychotherapy can also obtain a psychotherapist permit. And the 4th one, psychoeducator. So this is very unique to Quebec. I don't think it exists in other provinces. And I could be wrong, but from what I have heard so far, it is very special to Quebec. And you do need a master's degree in psychoeducation. I think it's provided by several French universities in Quebec. So psychoeducators provide evaluation, counseling, preventive action, and preventive rehab to people who have psychosocial adjustment difficulty in order to promote their independence and to resolve or prevent conflict. So this is word for word the definition from the psychoeducators, the Order of Psychoeducators of Quebec's website. If you're interested in finding out more, I would suggest to check out their website with more definitions and specific details on what they do. All right, so the next page is a list of resources. These are, I know, are pretty generic ones. If you'd like to have more specific information, feel free to reach out to me or to one of the YAHPA members. So the first one is the Order of Psychologists of Quebec, the OPQ website, official website. And the second one is the Canadian Psychological Association, the CPA website, and then as well as the APA, the American version of the Psychological Association. All right, so that concludes my presentation today. And I think next, are we entering into Q&A? I'll let Natalie take over.
Thank you so much. It's so interesting to me too. I'll start by letting the people who want to raise their hands and ask their questions directly, if there's any. You can raise your hand and I'll let you ask your question directly. Otherwise, we have some questions ourselves because there's none in the chat, but we still have some questions. I'd like to know, is there, like, what are the differences between what you imagine the job would be and what it is in reality?
Okay, great question. You know, the first thing that I thought of after you asked the question is one of the memes I see on social media. You know, the ones with what I actually do, what people think I do, yeah. What my family thinks I do, right? So did anything surprise me? I think with clinical psychology, there's definitely a lot more dealing with, you know, in hospital settings, well, at least in my training, I think I did a lot more training in hospitals and clinics. And so I guess the part that I didn't know about is the research part, right? I didn't know that, you know, we had such a big mix of those, that all these different directions that one can go into, you know. And there are some of my colleagues who entered psychology thinking that that they have to work with people, and you don't. Like I said, you can work with animals if you want. You can work purely in research and not talk to anyone if you don't want to, or you can talk to people all day and work only with people. So I think this was one of the aspects that I really didn't know about before really going into the field, right? Because, you know, if you look at these memes that exist on social media that says what people think I do, right? Like it's not exactly accurate as to what we actually do. Yeah, so it's like there are so many different directions, endless possibilities. I find that's really what surprised me and what was unexpected.
Interesting. Someone in the chat asks, do these jobs require a doctorate degree generally?
I think so. To be a psychologist. So like I said in one of my earlier slides here, and this is from both the CPA and OPQ websites, that in order to be a psychologist, in order to practice as a psychologist, then you do have to have a PhD. I think in Quebec they changed this in 2006. Before then, it was a master's degree was okay, but then after that, the government raised it to a PhD. The other provinces have done that much earlier, but in Quebec it was 2006. So I think generally, yes, you do need a PhD to be called a psychologist.
If there's no one else, I'd also like to know, so the person says thank you. I'd like to know, there's not a lot of Asian speaking psychologists in Montreal, or just in Quebec in general.
Or in
Canada,
what do you think are in North America?
Yeah,
in the
general,
profession in general. Yeah.
What do you think are the biggest challenges for Asians in this field?
Yeah,
because I know it's hard to get into the PhD program, but in general, maybe why do you think there's maybe less Asian people?
Yeah, I think that there are a variety of different reasons, but one of the top ones is that there's culturally, right? If we look at physical health and mental health, that there's definitely a lot more emphasis on physical health, right? So if we're looking at our parents or grandparents, I think culturally they always ask, hey, have you eaten? Have you, did you put on enough clothes for the cold weather, right? This is something we hear growing up a lot as Asians. And yet we don't hear, hey, how's your mental health doing? Right? Like, are you happy? Are you sad? Are you, right? There's much less of that. So growing up, I think there's so much less emphasis on the importance of mental health. And there's not enough awareness, I think, in general. It's getting better, of course. I think especially with younger generations, but I think overall there's not enough awareness as compared to physical health, and so people may not even know that there's like this field that's so important for our health in general, right? So I think this is like one of the biggest reasons. And the training itself, as we saw, like at least 7 to 9 years, up to 12 years, right? Like it's a long journey. If you're thinking about going into this field, be prepared, right, to go the long way. This is really a marathon. It's not something that you can finish. I think in general, right, in healthcare, I'm sure the other healthcare professionals have talked about this as well, how long it takes to get to the end and get your degree, get your licensing, and then all of that. Yeah, the training is pretty grueling, especially if you're combining research and clinical practice. Both of this, it's kind of like, it feels like getting 2 degrees at once. That's what I felt like.
How passionate do you think people who want to pursue this should be before they embark in this journey?
Well, I mean, I think, I stumbled into it. I didn't plan this. Like, it wasn't something like, oh, since I was 3 years old, I knew I wanted to be a psychologist. I didn't know what psychology was in high school, actually. So, I think you have to be curious to start out with. I was really curious, so I took psychology, the 101 introductory course, and I was hooked from there on, right? I thought this was so fascinating. How come I didn't know about this before? How come none of my high school teachers ever told me about this? Like, what is this? So take some courses, I would say, and not just in psychology, in anything that you might be curious about. And then decide kind of, I did this elimination thing, right? I'm like, okay, not interested, like working with computers. I think that was one of the options, right? Programming was very popular. And so I was like, nah, I don't want to work with computers. I want to work with people. So you have to know yourself, right? So you don't necessarily have to be like from the get-go, I'm so passionate about this, I'm going to do this for the rest of my life. I think most people don't start out that way, right? Maybe a few, but most people don't really know because you don't have enough of that exposure.
Okay, thank you. I'm sure the people in the event learn a lot. I feel like I learned a lot myself. So the time is up for Dr. Shi. If you have any questions, you can message our Facebook group afterwards, and we'll try to see what we can do. So we'll welcome our next guest, who's a clinical sexologist. Her name is Kanika Safan.
Hi, can you hear me well?
Yeah.
Okay, super. All right, so do I just go off like that, or somebody start with a question?
Yeah, for sure. So you have 10 minutes for your presentation, and then we have 10 minutes for questions.
Okay, super. So my name is Kanika. I was born here. My parents are political refugees from Cambodia. I'm now a sexologist, and I like that you said clinical sexologist, because sexologist can do a lot of things, and I would say that I think I'm one of the only one of my year, let's say, that now works in private practice, because most of the people that I studied with now, they are psychosocial workers, I would say, in like community centers. So the first thing you should know is that like everything I'm going to speak is very specific to Quebec, because we only have the order that in Quebec, so it's a protected title. If you are in another province, there's no like legislation concern regarding that title. So a psychologist who works with XYZ, or even a doctor or a urologist, could call themselves a sexologist. Sexologists in Quebec you can only become a sexologist if you go through the program at UQAM, which is in French. So that's already like one of the biggest problems, I would say, is that it's like sexologists, unfortunately, it's a very homogene like profession. It's mainly like francophone white females, and so I'm clearly one of the only one who's not only like francophone white female. So that's one thing. Every university in Quebec, there's like you can do a certificate, like a 1-year program, or there's like a program that concerns something related to sexuality, but it doesn't lead to the order of sexologists in Quebec. For example, it's not, people will say like, oh, so it's like gender studies. Oh, so it's like that certificate I saw at Laval concerning sexual violence. Yes and no, because those are very specific. It's not as broad as what you would see during the bachelor's. The good thing about well, good, I don't know, it depends on you. The good thing about the program of sexology is that after a bachelor's, you can go directly on the market, let's say. I like to say that there's like two types of sexologists in Quebec. I'm a sexologist, and some sexologists go do a master's to get the psychotherapy license, which I don't have. And now that I've been working in private practice for 2 years, I don't feel like I would need to go back to school to get the psychotherapy license. So it's 3 years. It's 3 years. We learn to do basically 3 things. One of them is counseling, like I do now. The other thing is sexual education, so group intervention, and the third thing is research. So a lot of people would say that a bachelor's in sexology, it's too broad, but the thing is that yes and no. In terms of like, so my friends who are now in research, they say it's too broad, that it wasn't precise enough. Now that I'm in private practice, I find that the bachelor's was not narrow enough, and the people who work who are sex educator, they think the same. So I think it's good that we get to try, like that we get to try and see all these 3 branches that we can go, and then when you finish your bachelor, either you go do a master's, and you choose like which of the 3 branches you want to do. Unfortunately, I think that most people don't choose the clinical, like private practice route, because there's a lot of financial instability. You're a freelancer basically, and it's the same. It's mainly the same thing with psychologists and psychotherapists, unless they find like a clinic and they become an employee. So a day in the life of a sexologist, I see clients. I see about 50. I have like 15 to 25 clinical hours per week. More than that, I just feel burned out. The other days, like, so I'll see them three days a week, 3 afternoons. The other days, there's a lot of like admin / case notes related to the clients. And the thing is that I also became, like, I used to be a solo practitioner, and now it's like I'm starting a group practice. So I have like, because I had like a high demand of clientele, and I had to refer them out. I now have other sexologists, and they take like the new clients that I can't have. So I'm switching jobs from doing the therapy counseling one-on-one thing, and also like just growing the clinic basically. And I really like that. I found that when I only did the one-on-one aspect of my job, I felt lonely and very isolated. So then I came back to do like I want to do less clinical hours with clients, and I want to do, oh, sorry about that. Ooh. And I want to free more of my time to do more sex education in front of groups, and either in front of groups or in the media, because well, it's only in French though, but I've had some segments on the radio, on TV, and in print magazine, and I really like the idea of reaching a broader, like a larger audience, because the people who come in private practice, they can afford private practice. So I feel like I can help, like private practice, you get to help individually people, like a narrow amount of people, instead of when you work in a group, like for groups or for the media, you get to help at a less individualized. Sorry about that, it's my phone. It's not, so I'm so sorry about it. I'm in my mom's room and I don't know how to turn off her. So yeah, I want to like just vary a bit the type of task that I'm doing. The stress level was very high because when I was starting, I just well, you know, like you get imposter syndrome, and I felt like I spent a lot of time being other things than a sexologist. I spent a lot of time just building the practice, building my name, building the clientele. Now it's getting a bit stabilized, but so I'm more comfortable in the role of sexologist, like what happens in the office, but all the like there's a big side of like how to manage that thing, let's say, and regardless of if it's a sexologist or any other type of business, that was the aspect of my job that stressed me more. So the easiness of finding a job, well, I had to create my job basically, and that's the thing why I started private practice. It wasn't my first choice. It was more because when I graduated a degree in sexology, people would say, "Oh, is it like psychology but with a specialization in sexuality?" No, not really. It's more like social work. It's more like social work in the sense that it's very very militant. I don't know how to say that in English, but we focus with, we all, like every sexologist, we focus with a marginalized group. Okay, so I worked with, and I work with immigrants. When I graduated, I was like, okay, well, I want to continue working with immigrants because I saw that not a lot of sexologists were not white. So I graduated and I was like, but I don't want to work in a community center, because then I would never be able to just afford living in Montreal ever. And also, you know, like the working conditions are pretty difficult. So I knew that I wanted to work with immigrants again, but not in a community, like dans un organisme communautaire. So I tried to find a job. Job searching was like not enjoyable at all. It was like, felt like dating, but worse. So you don't find a job for like 6 months. Your self-esteem is like, oh, am I really, like, what's going on? And then I gave up. I started working for La DPJ because they were recruiting a lot. And the thing that people don't know, I would say, is that sexologists are like any other psychosocial workers. So yeah, you get to work as a social worker or psychoéducateur or what are the others? So there's like 5 degrees that when you finish that degree, the bachelor, you can go directly into like psychosocial intervention. I did 1 week at La DPJ and I was like, wow, this is a perfect recipe for a burnout. So I quit. But I was like, okay, well, I don't want to go back to job search. It's so depressing. So then I said, well, okay, now it's the time to try private practice. I did that 2 years ago and I'm super happy now because I understand even more how, yeah, I find that this job is just amazing because you get to, it's like, I could never say that my job is meaningless. So I love that part about my job. it would be possible to work as a sexologist in private practice and not have to do the, like, you could find a job, but then you could find a job as like an employee setting, but then you would do, for example, okay, you would do like 6 or 7 clients a day, which is enormous, and and then you would have the pay, like your pay would not be the same that if you were on your own. How can I say? You could have the stability of having like an employee job, but the amount of clients that they're going to give you, it, like, if you did the math and you were on your own as like a freelancer, it would have made sense, and you would have much more freedom in the things that of how you would work, basically. But there's like, not one is better than the other. It really depends on your level of the level of risk that you can live with, basically. And yeah, I don't know what else to say.
I have a question.
Yeah, go ahead.
So I don't think there's a lot of Asian, so like you said, there's not a lot of Asian people pursuing this profession. Did you live through any like taboo with your family? Like, how do you explain it to, maybe some people in this event are like réticents, or like that have some reservations about pursuing this career? Is there anything you want to say to them about that?
True. So yeah, with my family, it's of course, like, imagine I told my parents, like, I'm going to become a sexologist. People only hear the word sex and sexologist, and that's the thing that's sad. Well, I mean, I understand where it comes from. So it's way more vast than we imagine it to be, and there's a lot of education to be done with not only our friends or family or entourage, but just Quebec as a whole. So I'm going to put a link. Oh, sorry, not that one. Sorry. I'm going to put a link. I only have all my things in French though. So because most of my clientele are francophone, or at least bilingual, I didn't translate my website in English yet. And you'll see that there's like a list of reasons why people could go see a sexologist. And the thing is that sexology is not just sexual dysfunction. So there's like eight big themes in sexology. Yes, one of them is sexual dysfunction, but for example, that's not the one that I focus on. That's not even my specialty. Another, like, I'm gonna name quickly the 7 others. So you have sexual dysfunction, you have relationships, yes, you have I'm translating, so it might sound weird. You have addiction and compulsivity. Then you have
just maybe sorry, can you maybe just explain what is for people who don't work in the field, what is sexual dysfunction?
Oh, sexual dysfunction is, for example, erectile dysfunction, or whenever there's a penetration, my vagina tightens up and it's very painful every time I have a sexual, like, intercourse. Another thing that could be like low sexual desire, or what else? Problems with orgasm, or yeah. So they're very related to the sexual act, let's say. And there are sexologists who work with that, but for example, I think that's not the theme that I enjoy working with the most. Okay. I enjoy working way more with just relationship as a whole. So communication, breakups, dating, difficulties in general. Other people work with addiction and compulsivity. So for example, guys will be like, I think I'm addicted to porn, or I use a lot of masturbation to regulate my emotions. I don't know what to do about it. Another theme would be all the social, legal, and ethical aspects of sex. I like that topic a lot too. For example, I have a monthly segment on Radio-Canada, CBC in French, so on the radio. And there's a lot of like sociological comment that sexologists do. For example, social media and sex, or social media and relationships, all the sexualization of public space, let's say, sex work. That would be another example. Another theme would be, I don't work with that per se, but other sexologists are more specialists with that, would be everything concerning pregnancy, and contraception. Another theme, of course, is sexual orientation and sexual identity. Another theme is sexual violence. And the last theme would be like physical health and psychosexual development, for example, STIs or body image, or how does one build his or their like femininity or masculinity or none. So that would be another theme. Yeah. So like you can see that it's way more like it's not as narrow as people think, because there's the word sex in it.
And related to that, what kind of clientele do you work with, and what kind of other clienteles are there?
So since I work in private practice, it's surely like, and since I look so young, my clientele, they're from 25 to 35, very urban Montrealers. I would say a mix of white Québécois and a mix of immigrants, either first, second, third generation. I get a lot of I don't know if it's the right term in English, but interracial couples, because sometimes there's just cultural clashes. I do more, so in therapy, couples therapy would be like a subspecialty, let's say. I do that as well. There's a lot of I find that there's a lot of sexologists who are like, nope, I only do individual therapy because couples counseling is too complicated. I do couples counseling as well. But like when I look at my numbers, there's more people who go for individual counseling. And like that's in private practice. I also have this other like sex ed aspect to my job, because I realized that I needed to do something else than just private practice. So I do a lot of conferences for French classes that the government offer for immigrants. I go there and they have like language classes, but they also have like workshops and ateliers concerning like integration in Quebec. I go there and I speak about social sexual values. For example, we'll talk about gender equality, we'll talk about homosexuality, transsexuality, and we'll talk about the difference between harassment and seduction. We'll talk about divorce. When some people say, oh, white people, they change partners like they change socks, or they're not committed, or people are so cold here. So there's a lot of things that we get to talk about, and I represent their the reason why they came here, so that their children have a better life. So I say like, well, I'm also second generation immigrant, and we speak about cultural differences. Why did I choose this profession? It was luck. Like I didn't know what to apply for at university. So I saw sexology and I thought it was a funny name. Initially, I thought that it's about love and sex, but it's not just that. And I started and I was like, oh, wow, I loved it. I love this program. I did my 3 years, and yeah.
Thank you. I think, there's another question, and I think it will be the last one, because of time limits we have. Mm-hmm. So someone's asking me privately, so the Asian population actually faces a lot of challenges. You mentioned too, there's a lack of knowledge about sex education. So a few of them know the existence of sexologists who are there to help. I think that's true. And yes, the person saying like, I think there's a lot of sex ed that is needed, which I totally agree with. So thank you so much for the work you do, and like the advocacy. I think that's the word you were looking for in English.
Yeah,
like
advocacy. Good.
Yeah, it's
good.
Cool. Hopefully it encourages like people in this who are here tonight to pursue something different.
Yeah, and I'm gonna leave you a link. Okay, it's only in French again, but you'll see the difference. Like you'll see concretely, if the couple comes with a problem, what would a sexologist do with a bachelor's, and what would a sexologist with a master's do? Okay, and both of them are very helpful. So I'll leave you at that. I hope you have a great conference, and thank you for inviting me.
Thank you so much for your time, and for the cool website too. Like, it's a cool name.
Thanks. Thanks.
Yeah.
Bye.
Okay, bye. So our next speaker is a social worker, and their name is Yaoshi Tang.
So, hi everyone, my name is Yausi. Just a few words about the previous conference. I really enjoyed what she said, so found it was really cool. So basically, yeah, I am a social worker, and I'm here to talk to you about social work, which is a not very well-known field. I don't know how this is gonna work, but was planning before I start, maybe you guys can like raise your hand if you've heard of social work before. Don't know if it's actually going to work with all the Zoom things.
We have 3 hands for now.
Okay, so there's a few of you who've heard of social work before. So as I was preparing for this presentation, I was actually wondering, like, how can I present this? Like, what I'm supposed to say to help people understand what social work is. And what I came up with is actually a quote that I've read on social media before. And it says, when a flower doesn't bloom, you fix the environment in which it grows, not the flower. And I think it really summarizes really well what social work is. It's like when you have a plant and it's falling apart, you don't go pick on the leaves or on the petals or on the stem. You actually wonder, like, did I water my plant yesterday? Or does the soil have enough nutrients for the flower to grow? And I think with social work, it's like the same thing. Like when you see a person struggling with addiction or other mental health issues, you don't go like, what's your problem? Like you're lazy or you don't want to work. You actually start wondering like, hey, like what are the reasons that will help us explain why the person is acting the way he is and why is he struggling with things that he is struggling with right now. Okay, can change slide. So I got in touch with social work in this building. It's a homeless shelter. It's still running, but not all out of this building anymore. So it's called the Open Door. It's a wet shelter, which means that people can come in drunk or they can come in high on drugs, but they can't use on the premises of the building. And it will offer them like food and shelter and also some psychosocial support. And what I really found inspiring in that place was when I saw the intervention worker really sit with the people through their suffering and just be with them and value them as human beings. And that's when I thought like, hey, that's what I want to do. So then I switched program and went into social work. I think when I thought about the presentation, there are 2 main ideas that I think I'd like to share with you guys. It's a little bit more theoretical, but I'll get to the more practical side later on. So the first idea or approach, as you can see on the screen, is systemic approach. Just before I start, I want to say that this approach is taken from psychology. It comes from psychology, but it's something that we use in social work too. So if we go back to the homeless shelter to where I worked at, like, and to the people who go to those shelters, sometimes people like wonder why are they homeless people? Like, why are they on the street? And sometimes you hear people say, oh, it's because they're lazy, they don't want to work, they don't want to have an apartment, so they are on the streets. And actually, when I started working there, a lot of the stories I'll hear, it's a lot of stories about child trauma. Like there will be children who, when they were kids, the parents were absent, or the parents were alcoholics, or like the children had like abuse from a trusted adult when they were kids. And all those things will influence like how you picture yourself, how you relate to other people, and you also like your capacity to trust others. And that explains part of what you might see in society or part of what a person might live. You can click again. Okay, so if you can put it simply, like systemic approach is just the idea that the way that a family works will influence an individual's well-being, and that's an idea that we'll work a lot with in social work. The second idea, you can change the slide, is a structural approach, which is a little bit more specific to social work. And that's like the bigger picture. So when we talk about structural approach, we might talk about like any laws, politics, any action that the government is taking that will influence our life. So if we go back to those homeless people, more specifically to the indigenous community that are homeless, we might wonder, like, why are they homeless? Yes, we've talked about like family issues, but how come those parents weren't capable of providing for their children the way they should have done? So if we look at the indigenous community, you might have learned that in school, but there was colonization in Canada and in the States. And then in the 1900s, there were also the boarding schools where the kids were taken away from their family and put into boarding schools where they weren't allowed to speak their language, where they were cut off from their cultures, and where they also lived through all sort of abuse from the people who were running the boarding schools. So when those people come out of the boarding schools, they have all sort of trauma that come with them. And when they grow up as adults and then have children and the traumas are not solved, you kind of pass down your trauma to your kids. So I don't know if it's really clear, but simply put, structural approach is really all the bigger decisions and the bigger actions or the values of society that will have an influence on someone's life. And I think it's a really important idea to have in social work, to just get like to see how the way you are there's a lot of reasons behind it. It's not simply just you, but a web of connections and things that are happening around you that makes you who you are and makes you maybe struggle with the things that you're struggling with right now. You can pass. So I think today, if you're participating in this conference, is probably because you're wondering which profession you should pick or like which university you should go into. And I think a really important question to ask yourself is, why are you doing this? Like, why are you picking the profession that you want to choose? Like whether or not you pick social work, I think it's just a good question to maybe just reflect on and maybe juggle a few notes down and see where that leads you. And if you're interested in social work, I have a few ideas that could maybe help you get a better feel of what social work might be. And the best way to do this, actually, I think, is to try it, to have the experience. So there are a lot of community organizations who are looking for volunteers. So I'll give you a couple examples, and you could, just call them and say, hey, I'd like to volunteer. And by volunteering, you can just ask questions to the intervention workers and see what their work really is like. So at first, at the top of the page, there is Baobab Familial, which is a family organization. So they will provide all sorts of family activities to the people living in Côte des Neiges. Then to the right, there is Cactus, who works with the homeless population. They also give like injection material to people who are drug users. It's a fairly solid organization. There's also a Prise Deux, which is an organization working with people who are struggling with mental health issues from an alternative way. So like instead of just taking medication, they will like offer other types of ways to deal with your mental health problem. For example, they have groups for people who hear voices so that they can like find ways to maybe have a dialogue with your voices so that they can better live with them. And then I'll start with the one on the right, Plein Milieu. They have two mandates. The first one is to work with youth in high schools to prevent addiction and also talk about healthy relationships. And they also work with the homeless population. And in the middle, Comité d'Action de Parc Extension. I find that one's particularly important because a part of social work is also creating social change, and is also working in a more collective fashion. So, for example, the Comité de Parc Extension, what they do is that they take all the housing issues that people in Parc Extension live with, and they try to come up with a collective solution. So maybe they'll like organize a strike, send out a petition and things like that, and write reports so that they want to request more of a governmental action, like maybe have some rent freeze or have how do you call it, a register with all the rents in Montreal so that we don't increase them in a unreasonable fashion. And the other way that I suggest that you could try to get to know social work is actually to just use it. Go see a social worker. Like I think in most CEGEPs, in high schools and elementary schools, most three of those institutions have social workers on the premises. So you can really just go up to them and say, hey, like, what does your day look like? What do you do during your day, and what's your job like? And also, if you're struggling with more personal issues, you can also go talk to them. It's a good way to like get to know you as a person, but it's also like have first-hand experience of what it will feel like to have the services, I can say, of a social worker, and that will help you also get to know better what the profession is like. So that's it for me. I don't know if there are any questions.
So I'd like to know, someone's asking me, how easy is it to find a job as a social worker?
It's very easy. We're lacking social workers everywhere. You can work in the public health system, so at CLSCs, hospitals. You can work in the community organizations. You can start your private practice. So you won't, like, there's jobs everywhere. You won't lack jobs.
Another thing I'd like to know is, can you give an example of, like a concrete example of what you do during a social work intervention?
Okay, well, let's say I think it was around July or August, I worked with a woman who was not struggling, but dealing with grief. Her mother just passed away. And so what I did with her, a lot of it is like active listening. So it's not just sitting there and listening to what they say. It's also like reflecting to them maybe the emotions that they're trying to express. Like you can say, if I understand you correctly, you're feeling sad that your mother passed away, or like things like that. And you try to just, yeah, a lot of it is listening, active listening. Sometimes you might suggest some activities for them to do. Like, let's say that woman in particular, she was saying, like, I spent so much time taking care of my mother that right now that she's gone, I don't know what to do anymore. So maybe you can suggest, okay, let's make a list of the things that are your priorities. And then we pick one, we set a time during the week where you can actually do this activity, and you just go do it. And the next meeting we come up and we follow up and we keep talking about these things. Hope it answers the question.
The last question, the last question is, may I ask, what is the salary expectation?
So the salary expectation, it varies. If you work in the public health system, you start at $25 an hour. You go up to 45-ish within like 10 years. If you're working in the community organizations, it's lower. Like if you get 20 in a community organization, it's really good. Usually it's more around like 16. And if you have your private practice, it's much higher.
Thank you. So I was wrong. There's 6 more minutes. So we can take some other questions.
Yeah.
Given the type of situation that you encounter, is it hard to separate work from personal life?
I think you need to be strong and aware of your own personal life. Like, they don't require it, but I think it's a good idea, is that if you go into a field like social work, that you do yourself some therapy while you're training. And that's part of the training, because you actually like work on all the buttons that the people that you encounter might hit on. And you sort of like work through your own issues so that you're more peaceful when you're at work. And then it's also important to have ways to separate your personal life and your work, because sometimes it is difficult. I remember when I was working at a homeless shelter, what I was doing is that when I closed the door, when I left, I will say, okay, whatever happened at work stays at work. So it will be like my personal ritual. And depending on the population that we're working with, some will be harder to separate. Like if you work in mental health, it's a little bit harder to separate like work and personal life, just because the stories that you hear are so relatable. But if you work, let's say, when it's less psychosocial, then it's a little bit easier to separate from your personal life.
Another good question is, sorry, I'm eating. What inspired you to pursue social work versus psychology?
Actually, I started with kinesiology. I was registered in kinesiology at McGill, and then I didn't like all of the math and physics and chem, so I dropped out, and I found a job at the homeless shelter afterwards. The reason why I didn't pick psychology is because while I was in McGill, I dropped into one of the psychology class, and it was really theoretical. And I found it really hard at that time to take in that amount of theoretical knowledge. And I wanted something that was more practical. That's why I picked social work. However, now looking back, I think social work and psychology, they kind of go together. Like they complement each other. Like we have in social work, we have a lot of the more structural side, more of like social inequalities that we'll look into. But psychology really helps you like deal with the person's emotion. And that's kind of what you need when you have someone sitting in front of you. So I think they complement each other pretty well.
What's the most challenging part of your job?
The most challenging part, it depends where you work. I think it's the emotional weight. I will say the emotional weight. Like, say when I was working at the homeless shelter, is just looking at, hearing the stories of what people gone through. That was really hard, because there were things that I've never imagined was possible. And then sometimes your own life comes out when you work with them, so you actually also have to deal with your own issues. That'll probably be the hardest part, but there are ways to deal with it, like having debrief at the end of each day of work helps you like process what happened during your day.
And then what's the best part, or your favorite part of this job?
Being human. I think yes, like social work is profession, but I think for me it's also like a way of life. It's a way of relating to people, and teaches you a lot of simple tricks of how to listen, how to be a human being, how to look at people and understand a little bit what's happening. So I think the best part is really just to be able to be a human being, be there for someone, and kind of like walk with them wherever they are.
It's a good note to end on, I think. It's a good message to give out to people to like learn how to be human. So thank you so much for your time.
Yep.
I think we all learned a lot. So I'm gonna welcome our next guest, who is a chiropractor, Bianca.
Hello.
Hi.
Hi, nice to meet you. Okay, am I starting this right off the bat?
Yeah, you can start.
Okay, very good. Hello, everyone. I'm Dr. Bianca Chung, chiropractor. Ever since I've graduated, I've been practicing in Drummondville, so pardon my English if I may be a bit rusty. So next slide. So if I take a definition of what chiropractic is from the Association of Chiropractors from Quebec, chiropractic is really a healthcare profession that specializes in the diagnosis, treatment, and prevention of neuromusculoskeletal disorders, and what those disorders can have an effect on a person's overall health. Next slide. So here you have the systems highlighted. Next slide, please. So the focus is very much on manual treatment, including spinal and joint manipulations. So that's really what distinguishes us from other practices that can also work in the neuromusculoskeletal field. We also use soft tissue techniques. With the advancement of sciences, for some conditions, we can use complementary therapies such as ultrasound, shockwave, TENS, and other kind of things, but the main focus is always very hands-on manual treatment. Next slide, please. So people used to have this myth that chiropractors really treat spinal problems, neck pain, back pain, low back pain, but it's really overall body. It can be anywhere. For example, it can be carpal tunnel syndrome, a disease or a disorder that has like a numbing, tingling sensation. In the medical field, they can suggest surgery, which is considered invasive, but before you reach that part, you can go into chiropractics and treat it manually and see if it works. If it does work, you can avoid yourself a surgery. So it's considered non-invasive, you could say. So here's a list of other disorders you can treat as well in chiropractic. Next slide, please. So again, chiropractic is very either preventive or curative, which means if you don't have any pain, you can go see a chiropractor to keep feeling good, maintain your good health, or feeling even better still. Or if you do present some pain and disorders, we can help relieve that pain, but it's also a both field that we work. Next slide, please. So if I resume that, it's really alternative medicine, hands-on neuromusculoskeletal system, and very manual therapy. And the main tool is really called a chiropractic adjustment. And in the medical jargon, it can be considered a spinal manipulation. Next slide, please. So if I can resume what I do in my job, I really do a proper exam. I establish a chiropractic diagnosis. I can treat, and I also focus a lot on education, on what to avoid, what to do in order for the patient to avoid presenting the same problem later on. And it's also very important in my job to know when to refer, which means if it's not in my field of expertise, I got to send it to the proper place. Next slide. And whom is chiropractic care for? So most chiropractors have a very general practice, which means anyone from any background or any age can come into my office. I can do a proper exam and treat them for that condition. Some chiropractors really choose to orient their care into a very specific clientele or niche. The most common ones are really athletes, pregnant women, children, or senior citizens. In my case, after I've graduated, I started to specialize myself into athletes for a faster recovery. But lately, I find myself getting a small interest into pediatrics, so treating babies, treating children, which of course is a very different type of chiropractic care, you could say. Next slide. And afterwards, I know this presentation is very focused on college students and high school students. So I've included a part on how to become a chiropractor. So the first step is really academic training. Next slide. So chiropractors from Quebec are mostly formed into two different schools. Most of them are from Université du Québec à Trois-Rivières, or UQTR, which is at Trois-Rivières, and others are from CMCC, which is based in Toronto. In my presentation, I'll be presenting criteria from Université du Québec à Trois-Rivières because that's where I've studied, and I can talk to you more about my specific experience from there. Next slide. So before you actually apply to the program, you actually have to do an observation internship. It's really half a day. You go meet an experienced chiropractor, you watch him work, and you ask a lot of questions. The chiropractor has to send in a confidential form, which resumes how the student is, his personality, if he's curious, a little bit of information, and it's sent into the school. And you as an intern, you don't know what they say. And I strongly encourage doing an observation internship, whether it's a chiropractic necessary or not, because you really know the upside and the downsides of every job. You can really ask about anything inside, and it's really, really interesting. And afterwards, to get into the admission, you actually based on 3 criteria. Academic records, whether you're from college or university, your academic record is very important. It's evaluated for 50% of that overall score. For college students, your cut-R or R score, lately the latest student or the lowest R score that got admitted into the program was around 31.1, and in the last few years, the tendency has been consistently going up too. So it might get harder and harder to go into the program. There's a new aspect, which is the CASPER exam. In my days, I didn't have to do it, but I think nowadays it's very common any health sciences, health discipline programs to involve involve the CASPER exam. And you also have the interview to do as well, where there are teachers who ask you questions about how you are, who you are, get to know you, and to find out if you're a proper fit for chiropractic or not. If you ever have questions about the interview, feel free to ask me. I remember them properly from my days. So next slide, please. So other fun facts about the program, every year the application deadline is really March 1st. So make sure you do your observation internship before that and have it sent in before that. Every cohort is limited to 47 students. By the end of the program, most students are there. I'd say in my cohort, we've lost 3 students, but most of the time the retention is very, very good in that program. It's a full-time course study. It has 227 university credits, which I think is one of the biggest programs in Canada. The duration is of 5 years and 11 semesters. You have a summer semester in between the 4th and the 5th year, which is a lot focused on the internship. Each semester, because of the number of credits, costs about $2,200. You can also calculate an additional cost of $3,000. And the approximate total is of around $27,200. You can apply for some books, scholarships, I guess, to help you financially, but most of the times while working, you can repay that quite easily. Next slide, please. And so I've involved the class curriculum in the presentation as well. So that's what it really looks like. You have the first year to the 5th year, and between the 4th and the 5th year, you have a summer semester. Next slide. So before you graduate, you really need to obtain a few skills. So in the beginning, I told you that it focuses a lot on nerve, muscles, and articulation system, but you really need a basic training in everything. For example, a patient can come into your office and really show a presentation of lower back pain, but that might actually be an infection in the renal system. So you really need to be able to distinguish where that pain is coming from. And if it's not in your field, you need to know where to send it. So send it back to the doctor in that case. So next slide. I've highlighted those classes in the basic sciences for you in this slide. So next one, please. Afterwards, you really do need specialized training, of course, in chiropractic discipline, whether it's developing your tact, doing a proper exam, radiology, how to do a radiography, how to interpret them, and how to treat them in a chiropractic way, spinal adjustment, for example. Next slide. Next slide, please. So again, go back one slide. So again, I've highlighted the classes for you. For the chiropractic parts, it's the red dot, and the diamonds one, it's radiology classes, which honestly are super, super interesting, and it's really fun. It's also one of the components that distinguishes us from other neuromusculoskeletal fields, in the sense that we can prescribe radiographies, and some others are more limited in that sense. Next slide. And last of all, you need clinical training hours. It's a lot of theoretical training, a lot of practical training, and a lot of internship hours. So in those hours, you learn how to be a proper chiropractor, proper clinician as well. So next slide. Also highlighted by the golden stars. So next slide again, please. So if you finish your academic training, you have to do your CCEB exam, which is the Canadian Chiropractic Examination Boards. Next slide. There's three main components. You're evaluated on chiropractic knowledge, clinical decision-making, clinical skills demonstration, which really allows them to figure out, are you going to become a standard practice chiropractor? And if not, then you can try again, but study harder. I'd tell you, if you have been a good student throughout the whole program, you should have no problem passing those exams. It's a very stressful event, but otherwise, you should have the knowledge to do it properly. Next slide, please. And then afterwards, if you've passed those exams, congratulations, you're officially a chiropractor. But before you start practicing, you have some licenses to pay. And if you think you're done with school, you're absolutely not. Every year you have a minimum of continuing education credits to do. And because you are allowed as a chiropractor to prescribe radiographies and interpret them, you also have some radiology credits to get every year. Next slide, please. If you ever do miss school, you can specialize yourself in different fields. Those are the main ones. Clinical sciences, orthopedics, diagnostic imaging, physical and occupational rehabilitation, which is a new field actually, sports chiropractics, and pediatrics in different types of school, but it's very deuxième cycle, you could say, of furthering studies. Next slide. And I've been asked to talk about the placement rate. So in theory, as a chiropractor, you have a 100% placement rate. And the reason why is because chiropractors, especially in Quebec, well, I think throughout Canada and even America, you are a self-employed worker. So most people after graduating can choose to work in an existing clinic. I, for myself, chose that field. You build up your clientele slowly, and then you work the way you want. Some people can open their own clinic right off the bat, or decide to do so later on. Or you can choose to do maternity leave replacements. You get a higher volume, you get a higher pay, but you don't really build up your clientele from the get-go. So you build experience in that sense. And if you choose that working manually is not for you, you can also do research as well, or combine the two of them. So next slide. And afterwards, for the real talk now, the pros and cons of chiropractic. So the title of Doctor of Chiropractic is honestly very cool. So for all those parents that want a doctor in the family, you are one. So you can call me Dr. Chung, actually. And joking aside, the job in itself is also very cool. So every time my patients ask me what I like about my job, I really tell them I help people, I treat people, and I really chat throughout the whole treatment plan. So you really get to build some relationships, to celebrate their wins with them. You get to know them, befriend them, but you also need to have that boundary set, right, as a professional. You're also considered a first contact professional, which means any kind of problems can come into your office. And you always have to stay sharp and know, oh, I can't help this, I can help this, oh, maybe this person will be better, and refer it to the proper place. So you never really get bored of your job. And if you honestly do, you can branch out, you can specialize yourself in so many fields, and there's always further studies to go on. Another aspect that's very cool is being a self-employed worker. So you have an autonomy, and you can also play with your schedules. Say, For example, Saturdays, I usually work 9 to 4 because I choose to do so. Last night, I went to a concert, enjoyed myself, and I decided to start at noon today and finish earlier to prepare myself for this conference. And it was honestly very okay. No one has any say in that. And so, yeah, that's a very fun part. And also the salary in the health field is very good most of the time. And since you're a self-employed worker, you really choose how you want to work. Say my practice, which I want to do the most I can for my patients, especially athletic patients, which need a bit more of a fluff around, complementary treatments, you could say. I see about 2 to 3 patients every hour. I was talking to one of my colleagues who practices in downtown Montreal, and he sees about 5, 6 patients. So he's really fast paced. He runs around the whole day. And the salary varies with your performance, you could say, or how many patients you want to see per hour. So that's very fun. And for those who want to reach over $100,000 a year, it's very obtainable, actually. So next slide, please. And so the cons of the chiropractic field. You could say it's a very less known field than physiotherapy, for example. It's a very young profession as well. So there's always this kind of confusion and prejudice about what chiropractors do, what chiropractic is. So the educating people never really stops, whether it's your patients, your family with their questions, even professionals, medical doctors, or other parts. You always have to teach them about what you really do. So that's that. It's also in the private sector, which means it's quite costly to do treatments. Say you have a patient who you evaluate, he needs about 6 to 8 treatments to gain his highest potential in healing, and he unfortunately only has the budget for 3 seances. So you have to make do with what you've got. So you really have to make the most of it, and it happens actually quite often. Most of the time, people now have insurance, but it's not everyone, so it can limit you to a higher wage population as well. And the downside of being a self-employed worker is you have to be responsible for yourself. So the first few years are also a little bit harder. You have to hustle a lot, work harder to really build up your clientele. And it plays a bit with the schedule. As much autonomy I have, I also have to adapt myself to my clientele, which mainly involves workers, right? Office workers. So to really allow them to have the possibility to facilitate their schedules, you do have to work after office hours. So say in my example, I work on Saturdays, which I choose to, but also during the week, there are 2 days I work from noon to 8 at night. So that can be a downside for some people who want to have families or activities at night or in the evening, but that's mostly limited to that. So next slide, please. So actually, that's pretty much it. I hope that answers a lot of questions about chiropractic. And if you have any questions, feel free to write to me or contact me. Thank you.
Thank you so much for the comprehensive presentation. Questions we have. So someone wants to have the PowerPoint, which will be possible. Someone's also asking, are you planning on specializing? Why or why not?
I have started a specialization with athletes actually. And while practicing, I find that athletes have some particularities that it's different, we could say. So lately I've been developing an interest in pediatrics, and honestly, I think I will do that. It might not be for this year, but most likely next year. And it's really bringing much a next level challenge, you could say. Yeah, so that, yeah.
And last question before the break, what's the difference between chiropractor and osteopath?
It's really about the formation, you could say. Osteopath is not yet recognized as a profession in Quebec, at least. They can have very different standards of practice from either the school. It can be like a 2-year formation. It can be like weekend formation. It's very, very variable. So that's one of the main points. Honestly, as a chiropractor, I don't talk much about it because every osteopath really practices in a different way. So some people can do one type of treatment, you go see another osteopath, and it's a very different kind of treatment. So there's no standard practice, you could say. Another thing that distinguishes chiropractors from osteopath is they don't have a ordre. I don't know what it's called in English, ordre professionnel. So say if I do something that's not in my field or something that injures my patient, they can always report me to the ordre des chiropratiens, and it's investigated. So it's really an organism that protects the patient. And for osteopath, I don't think they have one yet. I know it's been talked about in the past few years about creating one, but it's been on the table for at least a while before I started school. So over 8-9 years, I think. So that's one of the main components in the treatment as well. Chiropractic is very focused on the spinal adjustment, which is an act that's reserved to chiropractors. So the famous cracking treatment, chiropractors, osteopaths should not do them in that sense. And also, I forgot, shout out Viviane, my cousin too. Yeah.
We have time for maybe 1 or 2 more questions. Someone's asking, how challenging are the studies?
I'd say you are very well surrounded. There's really a sense of friendship and a group feeling with your friends and your colleagues because it is a hard program. It's a lot of classes. I'm the 3rd child in my family, and I've seen my older brother, my older sister study, and they were always talking about how much fun they had going out and playing around. I did not have time. The first semester I did that, at midterms, I got smacked in the face by reality, and you really need to be consistent in your studying. So it's, I think it's challenging, but it's also very rewarding as well after you complete your studies.
So there's a lot of working with different health professionals. Do you, in your practice, work with other people, or it's like more private and separate?
Well, it is considered a private field, but in Drummondville, maybe it's like a campagne setting or like an agricultural setting, but we have a lot of collaborations. Medical doctors send us patients. When we are reaching a certain point, we refer to physiotherapists. Ergotherapeut, I think it's occupational therapist as well. Sometimes massage therapists, even if they're not considered as a professional in the sense of having an ordre that kind of contains them, I guess. So there's a lot of collaboration actually in Drummondville. There hasn't been a lot, there's always this rumor of physiotherapists and chiropractors being at war with each other. It's not the case in Drummondville, at least. Maybe Montreal, maybe somewhere else, but not from what I've seen in Drummondville.
Okay, cool. And then last question. How did you stumble into this field? Like, did you always know it existed when you were
Not
at
at
CEGEP?
all. Not at all. Actually, I have to really give credit to the observation internship. It's a very funny story, actually. I didn't even know what chiropractic was. And while I was scrolling down the list of health fields, I was chatting with one of my friends and he said, oh, I see a chiropractor. I can call her if you want. And before I could actually say, no, that's too much trouble, he was calling her and he handed me the phone. So I had to go do it. And after that observation internship, I really fell in love with the profession. I thought, oh my God, what is happening? I have no understanding of what's going on. So I kept asking a lot of questions and I found myself really curious to go into that. So I applied, I did the interviews, everything went well, and I actually got in. So that's how I stumbled upon chiropractic, actually.
A bit by accident too, a bit of chance.
Yeah. Coincidence, luck, the universe, whatever you want to say. But yeah, it was very coincidental.
So yeah, just like have an open mind. It's cool to like discover new things, I think. Yeah.
Yeah, exactly.
Okay, so I think that's gonna be the last question. Thank you so much.
You're
It was
welcome.
very interesting.
Cool.
So we have
And
5 minutes of break and we'll come back at 6:35.
okay, sure. And if anyone has questions, they can feel free to write to my email address, actually. I'll be glad to answer any questions. So thank you.
So during the break, I would like to invite everyone to fill out the survey to just give us some feedback or ask your questions. If you have more questions about a specific program or how that specialist did their studies, so or anything, or like if you want to join the YAHPA team, you can also message us. So I'll also profit from this time to give you a brief presentation of who YAHPA is. Because yes, we are organizing this conference for students to explore more healthcare professions, but this is not the only thing that we're doing. So YAHPA is founded in April 2020 during the pandemic. Our first project was to inform the elderly and isolated Asian population about the updates about the pandemic, provide support and resources to this more isolated population who might not have access to internet or who don't really watch TV. So during the pandemic, they would be very lost initially. And later on, we became an official nonprofit organization registered with the government of Quebec. Our mission is that we are a group of professionals from various health fields. We aim to empower the Asian community by providing accurate scientific and medical information to eliminate any misinformation due to language barriers. We also want to act actively as an intermediary, translator, promoter, and speaker so that everyone can have equitable access to existing medical resources. We have several goals. First, to propagate good scientific and medical knowledge to Asian population of the Greater Montreal region. Second, to promote good practices in physical and mental health. Third, facilitate access to the various health and social services resources available. Fourth, promote the various healthcare professions such as medicine, physiotherapy, occupational therapy, psychology, kinesiology, nutrition, etc. Fifth is to promote and encourage the involvement of young people in carrying out projects for the Asian community. And last, to empower healthcare professionals to improve their communication skills and optimize the way they take charge of Asian clients. So as you can see from our mission and goals, our public include the general public, the youth, and healthcare professionals. Some examples of what we have done in the last years since the creation is we have first the information pamphlet about COVID, and we have translated in different languages the governmental policies for the confinement. Then we have the second project, which is a platform with around 250 to 300 healthcare professionals in Montreal. So they're from different domains, they speak different Asian languages. And we sometimes receive requests from the public or healthcare professionals to have a certain resource or service. So we're being an intermediary to direct those services. And the third project is about mental health. For example, at the beginning of the year, we have a Chinese conference with 70 people attending. We're also organizing a series of Vietnamese podcasts about mental health. Our fourth line of project is this series of conferences for the students, like this one. So we want to encourage students to discover more about the career that they want to pursue in the future. For now, all the members are volunteers, and we're thinking about expanding our team in the next year. So if you're interested to join the team or just be a volunteer, please let us know. I'm going to leave the contact in the message section in the Zoom. Thank you.